you all to the question answer session is given in the last. So no questions in between the lectures. Our next speaker is Dr. Professor S.S.Jha, sir, and he will be talking on pathodynamics of paralytic calcaneus and management by unique personal sling tendonitis. Thank you, sir.
Right. Thank you, Mr. Chairman. Well, from hot topic in orthopedics to cold. Friends, we keep on tackling patients of paralytic foot deformities, and equinus is one which is very common. But here you can see the foot which has a deformity opposite to equinus and is known as calcaneus. Now, in the presence of muscle imbalance, subtalar joint movements were studied, and the instability of the calcaneum was noticed, and Parabouf classically described it that the calcaneum pitches, turns and rolls under the talus. In fact, the calcaneum plunges and rolls on itself like a boat over waves. All of us are aware about the subtalar joint, but I am pretty sure most of us are not aware what we now call existence of calcaneal joint. This is a not very recent, but still a recent understanding. So helicoidal movements do take place at the subtalar joint, and this reinforces this important concept of calcaneal joint. Talking about helicoidal movements, they are combination of rotational and translational motion when an object moves in a circular path while also moving along an axis. So the tibialis and the peronei and simultaneous supination and pronation determine what kind of associated deformities will be there, varus or valgus. Now, one more word I would like to emphasize. There is loss of impulsion in a calcaneus deformity. So while we are walking, impulsive forces are repeatedly introduced into the musculoskeletal system. In calcaneus deformity, in final stance phase of the gait, there is loss of impulsion with foot dorsiflexion and toe extension. So there is retropulsion. So what is this retropulsion? This is associated insufficient posterior activity of the calcaneal tendon leading to posterior subluxation of the tibia over the talus. So for correction of a calcaneus deformity, what is the best surgical option? So we have to achieve a balance of the imbalance, and tendon transfer with normal muscle power to the calcaneum is the option, or tenodesis effect on the heel with available peroneals. Well, my unique surgical procedure is making a peroneal sling tenodesis. It has 5 steps. After preliminary plantar fasciotomy, give a lateral incision. Step 1, longus and brevis are cut. Step 2, the distal ends of both the tendon are stitched together. Step 3, longus is plicated through the tendo-achilles. Step 4, brevis is passed through the calcaneal hole. And step 5, both tendons are sutured over the calcaneum. So to demonstrate a case, through the lateral incision, the peronei have been dissected out, the distal ends have been cut and are being stitched together. The peroneus longus tendon is plicated through a hole made into the slit made into the tendo-achilles, and a hole is made into the calcaneum. Finally, the peroneus longus tendon is taken out through that hole, and the peroneus brevis they are stitched together. This is the final result. So friends, the take-home message is that this is recommended for an immature foot with calcaneus deformity, and this might prevent a future arthrodesis. Thank you. Thank you very much.
Any questions? Thank you, sir.
Right. So I have delved into the pathodynamics, and I hope few newer terminologies like existence of the calcaneal joint, the retropulsion, which initiates posterior subluxation of the tibia over the talus, they are understood. Thank you. Thank you very much.
There is a little bit of interruption.